Understanding disruptive innovation. We'll take a closer look at disruptive innovation. It's a form of radical innovation that transforms business practice and competition. Disruptive innovations often exceed what the market needs at any point in time. And because these innovations exceed what the market needs, there is some confusion, some unawareness, there's some opportunity that gets created by a disruptive innovation. It opens up new ways for customers to find new products and services. Not only the product or service itself, but the way in which a customer would find that product or service. And disruptive innovations often exceed the current limits of technology. This is where technology begins to come into play and influences the way in which innovations can be implemented in the marketplace. They meet the needs of customers where they often don't know where they have a need to be met. So there are innovations that are disruptive that respond to things that customers don't even know they need yet. So what are the forces that influence disruptive innovations? Dominant players tend to focus on sustaining innovations. And where they focus on sustaining innovations, they improve products and services for typically high-end customers. They're basically trimming the high-profit, high-value customers with the innovations that they have. Their improvements will often surpass the needs of most customers. When they make an improvement, they're way out ahead. They're providing a relative improvement in the product or service in which they're offering that goes beyond what the customer needs. On the other hand, new firms tend to introduce disruptive innovations. They recognize they can't compete with the dominant players, but they introduce cheaper, simpler, more convenient products and services. And they tend to target those products and services to the lower end of the market. People who have a need, and it's often a larger market slice, but aren't necessarily willing to pay for the innovative product or service that the dominant players have. And third, disruptive products and services tend to improve over time. Eventually, they serve the needs of majority of the marketplace. So when you introduce a disruptive innovation, you're often only serving a small part of the market. But over time, the rest of the market begins to see the value of that disruptive innovation. And so these disruptive innovations become threats to established market leaders. And so that is the nature of the disruption. So let's take a look at the curve here, a graph of disruptive innovation. This is a classic one developed by Clayton Christensen from the Innovator Solution. Clayton Christensen is kind of the father of the idea of disruptive innovation. And you can see that the blue line is basically the pace of product improvement. And the green line is just a little displacement. In other words, it's a product improvement, but not necessarily quite as dramatic as the product improvement that, let's say, the dominant players are providing. And what happens is that that level of performance of that product, that disruptive innovation, still meets the need of a large number of people in the marketplace. And so it serves, it catches the dominant players by surprise, and that disruptive innovation tends to take away some of the market share of people and companies who are in the dominant role. So let's compare incumbents. Let's say these are people who are dominant, or companies that are dominant, as opposed to disruptors. Those are new entrants. So the incumbent, the one example might be Microsoft. And a disruptor, in this case, is Google Docs, which offers a very different, very accessible, low cost, relatively easy to use, and transportable product that is competing with Microsoft Office. On the one hand, Intel, the maker of chips, and ARM, a British company making RISC technology chips. And they're disrupting them by making them a lot cheaper and a lot more powerful. On the left hand, we have another incumbent, cable TV. And then we have Google Chromecast as a disruptor. And indeed, things like Hulu Plus and Apple TV and other things are other disruptors to cable TV. Delta Airlines as an incumbent is an example of an established airline. It could be United, could be American Airlines, and then the disruptor is Southwest or JetBlue would be airlines that are offering a different way of providing air transportation at a different way. The incumbent, H&R Block, you used to go to H&R Block to get your taxes done. Now you can do them online with TurboTax. And H&R Block actually has reinvented their product and it now has their own version of digitally based tax help. So incumbents and disruptors. Disruptors cause incumbents to do different things. And by introducing disruptive innovations, they cause incumbents to rethink their competitive approach and to introduce innovations that they themselves would become more competitive to those who are disrupting them. So this example here, it's a very large scale diagram, is a description of an innovators with, that had disruptive origins. You can begin to look, I like to pick out the one that's not highlighted, but it's in the upper middle. McDonald's was a disruptor. The whole idea of McDonald's, introduced really in the 50s, was about, it revolutionized the fast food business. Honda motorcycles right next to it, introduced in the 50s, was a whole new way of delivering two-wheeled motor-driven vehicles. You can begin to see Canon photocopiers, Dell computer down in the lower right, introduced a whole new way of providing digital computers, personal computers, in a way that you could customize them. So they had a very innovative sales process, a very innovative relationship process with the customer. And that was innovative, that was disruptive. And so each of these names on this chart represent an example of a firm that disrupted in their own way, in their own industry segment. So let's take an example of the healthcare industry and talk about how disruptions occur. We can talk about disruptive innovation players in the healthcare industry, and in this case they would be technology firms that are producing medical equipment, nurse practitioners who are providing an accessible way for people to perform and receive health care, and generalists. They also serve what we call least to moderately demanding tier of patients. And those are the majority of patients, people who don't have dramatic healthcare needs, but they have ongoing healthcare needs. And what happens is disruptive technologies actually, they enable diagnostic pattern recognition. And so the technology of that is now used by these disruptive innovation players is much more affordable, much more usable, and they can be much more powerful in their medical diagnostics. And so those players use those new technologies to really change the way in which healthcare is being delivered today. And disruptive actions, so where technology is introduced and adopted, you have improved level of care at lower cost, and you have these disruptions that confront the dominant players to gain market access. And so the different ways in which healthcare is being not only delivered, but administered and analyzed and followed through on is very different today than it was. And it's disrupting the way in which healthcare industry operates. So we can look at three levels of healthcare disruptions. One is something very simple. It's what we call rule-based diagnosis and treatment. In other words, there is a whole series of guidance that is based on evidence from medical research that tells people in the healthcare industry how to respond to certain symptoms. Then there's data collection, and the accuracy of that data collection yields what we call a proven strategy for that type of rule-based diagnosis. The middle tier is where you have pattern recognition and treatment, and you have, again, greater value of multiple data sources. So you have firms or hospitals or medical organizations that have access to very large banks of data about what the symptoms are and what the consequences are of diseases. Outfits like the Cleveland Clinic, Johns Hopkins, the Mayo Clinic in Minnesota. These are large-scale medical institutions that have these capabilities. And then we have what we call the complex tier, where there are new technologies that are being introduced that help healthcare providers do problem-solving diagnosis and treatment. And the analysis and collective experience of team judgment, where there are groups of medical professionals together, where they talk to one another, where they share their experiences, where they share their diagnoses. And third, where there is a testing cycle, and where there are hypotheses, where there's research and hypotheses and experimentation that yield new knowledge about where healthcare is effective and where it's not effective. So these three tiers are the levels at which disruptive innovations can happen. So let's just have in our minds this fundamental trajectory of a disruption. We have the red line, which is really the dominant need of most of the marketplace, and then you've got the blue line, which is the pace of product improvement that most incumbents, most dominant players have, and then the green line, which is the line of product improvement that is less, but it's adequate to meet the needs of many people in the marketplace. So let's apply that to the healthcare industry. So we start with looking at the demand band here, the orange band, and that is the band between the most demanding healthcare customers and the least demanding healthcare customers. And you can see that the performance trajectory of most healthcare organizations exceeds what the customers actually need. And where down at the bottom you see that other arrow going into the band where you have disruptive innovators, where they're providing what some customers want but not everybody wants, but they're penetrating into the middle of that market band. So you have on the one hand, you have on the top, you have firms that are addressing multiple diseases, complex diagnoses. Those are the dominant firms, where you have on the bottom, you have innovative and disruptive innovative firms producing innovations and producing products and services that do the dominant meet the dominant needs of the marketplace. So let's take a look at what's happening with healthcare professions. If we take a look at healthcare professions, what happens is the three healthcare professions, the classifications of healthcare professions, we can see the primary care and family practice physicians are way up. They're meeting the top tier needs of patients. The nurse practitioners are in the middle. And we could say that self-care and self-diagnosis is meeting the low end. And so the idea here is that you can see the pattern of where different types of healthcare professions are meeting different levels of patient needs. If we look at the disruption of healthcare institutions, we can see that at a couple of different levels. First, there's not a lot of penetration in terms of response or performance from in-home healthcare, but there is some. And if we look at another one where organizations now are providing nurse practitioner healthcare in their organizations. So that's addressing a great deal of fundamental need from patients. And we look at another level, we have outpatient clinics, which are popping up all over the country now. 24-hour outpatient clinics that are basically designed to deal with the high percentage, the high majority of needs of healthcare patients. And then finally, we look at general teaching hospitals, which have they handle the unusual and high demand needs of healthcare, the special cases, the emergency cases. And so what we find is that healthcare institutions are now being disrupted by things on the lower end, in-office care, outpatient clinics, and even in-home care that had formerly been done by practitioners, generalist practitioners, and hospitals. And so this is the kind of a disruption that's actually happening by meeting the needs of patients who don't necessarily need full hospital care treatment. So here are some summary ideas on disruption. Disruptive innovations dramatically change the way customers respond to a product or service. As we saw in terms of 24-hour clinics or in-office care or in-home care, all these things tend to displace what was formerly provided by doctors and hospitals. They tend to realign the positions of competing organizations. Hospitals, practitioner groups, and even large clinics are having to adjust the way in which they respond because of these disruptive innovations. And finally, they open the door to new forms of organization that reach customers in different, unique ways. So we're going to see a transformation of the way in which healthcare is being provided because of these disruptive innovations.